So, Dr. Joshi, how did you become affiliated with the Interstitial Cystitis Association?
Well, so we were talking about, it really started back in my fellowship training. We're one of the few fellowships that really address pelvic pain, so we learned a lot about pelvic pain and interventionally what we can do, what are some options when patients have pelvic pain. So there are a few options that we have for pelvic pain patients. There are a few options that we have for interstitial cystitis patients. And what's I guess just as important is there are options that we have for patients who are misdiagnosed as interstitial cystitis as well. So what happens in many situations is people will come in with pelvic pain, and if they haven't seen an IC expert, many times it's a urogynecologist that really has a passion and an interest and a good fund of knowledge of interstitial cystitis. And sometimes they get misdiagnosed as IC when in fact they actually have some type of other process going on, especially they can have some type of nerve processes going on. There's some nerves that actually can give you pain that makes it seem like you have interstitial cystitis when in fact you don't have interstitial cystitis. So that really is sort of how we got interested in the private practice setting. I guess I just ended up seeing more and more patients who were referred who either one had interstitial cystitis or two didn't have interstitial cystitis. They had previously been given that title, but then a urogynecologist expert realized that it actually wasn't interstitial cystitis. There was actually another pelvic pain problem going on, and so we were able to help those patients.
Great. Okay. Can you explain to our listening audience how the body and the brain perceives pain?
Yeah, and this is actually, this could really truly be a sort of an hour discussion right there.
Yes.
But we'll summarize it into, I guess, about 30 seconds. The body and the brain are connected through a couple different ways. Obviously, there are two different nervous systems: the central nervous system and the peripheral nervous system. So, the peripheral nervous system is what you sort of call when you feel something. If you pinch your finger or something like that, it's a peripheral nervous system. That's where you feel it. But it all gets transmitted through nerves up to the spinal cord, and in the spinal cord there are multiple different tracts in the spinal cord. One is called the spinothalamic tract, and that's where you have a lot of your pain fibers. I won't get into sort of how each of the tracts is dissected out and all the different levels, we call them all different lamina that are in the tracts, but basically it goes in there. There's some cross-linking that goes on in the spinal cord, then it goes up to the brain, and it goes to different pain processing centers in the brain. And again, that's where depending on what disease state's going on, even if it's just generalized chronic pain, over the course of time, there's something called neuroplasticity, and what that means is that the brain actually is a dynamic thing. It can change the way that the wiring is in the brain at any given moment. So when you have chronic pain, you actually start getting neuroplasticity. You start the pain starts getting hyperamplified over the course of time. It gets further compounded if those patients are on opiate medications, things like morphine and things like that. So it's a complex sort of relationship, but at the same time, it's definitely there, and one that needs to be respected, because if the problem peripherally, if the problem in the body, the arm or the leg or the back, if that's not treated, the brain gets affected. At the same time, if the brain is not addressed correctly, the body perceives more pain than it should.
Mm-hmm. And then you get the loss of your neurotransmitters, so you're going to get depression. Some people get anxiety. All kinds of things can happen to the person if they're not treated.
That's right. It's sort of that domino effect, and it's very quantifiable in the sense that, if you want to look at it just analytically and scientifically, you can see why that will happen, because you have various neurotransmitters, like you said, that you'll see either depletion of neurotransmitters or excessive other neurotransmitters. You'll see an imbalance, basically chemical imbalance. Any type of chemical imbalance will lead to alteration of homeostasis, and what that means is, staying equal, staying balanced. That's going to be altered, and usually alteration of that is not good.
Mm-hmm. Well, I know, and you can correct me if this is incorrect, but it's 85% of our serotonin is made in our gut. Is that about accurate?
A large percentage, yeah. I'm not sure about the percentage right offhand, but definitely a large percent. And you have two separate types of. one thing to remember is same thing with norepinephrine as well. Norepinephrine and serotonin are two neurotransmitters involved in depression as well as in pain. And serotonin and norepinephrine are both produced centrally and peripherally, in the sense that there's peripheral neurotransmitters. For example, norepinephrine, peripherally it's active in a totally different way than it's active centrally. So peripherally, norepinephrine is actually a neurotransmitter for the sympathetic nervous system. So it can actually transmit pain signals as part of the sympathetic nervous system. Now, centrally, though, norepinephrine acts in a totally different way. Abnormalities in norepinephrine centrally can give you alterations in mood, but also alterations in pain perception as well. And different parts of the brain have a norepinephrine effect that can potentially impart different sort of physiologic traits. So you actually see different disease states where you have an excess in norepinephrine or a deficiency in norepinephrine, and that's producing solely, almost solely responsible for producing different disease states. And same thing with serotonin, obviously. So, so yeah, absolutely. It's not only where it's produced, but it's also where it's affecting. Is a central or a peripheral effect.
And I've had, over the last 30 years, a number of clients come to me with anxiety and depression, and doing a thorough history, finding that they had the symptoms of pelvic pain or IC, sending them to the proper place to get diagnosed just revolutionized their life, because everywhere they went they said, oh, you're just depressed. Well, of course they're depressed, but there's a reason, a chemical reason they're depressed.
Yeah, that's right. And some studies will say about a third of chronic pain patients are depressed. But I would I guess maybe challenge that a little, in the sense that I think a lot of, even if a third of patients are, quote, depressed, a lot of them are called depressed when in fact they have depressive symptoms, but not necessarily what we call an axis disorder, which is a fundamental pathology in the neurotransmitters of the brain. It's an induced deficiency. It's not a fundamental deficiency. So if you address the underlying problem of the pain, a lot of those depressive symptoms will go away, and suddenly they won't be, depressed anymore. Now, some people have a sort of a fundamental depression, a depression that isn't what we call an axis disorder, which means that regardless of what you do, you can take all the pain away, they're still going to have depression, right? But it's not a third of those patients. It's a small percentage of those patients. And so what that tells you is, yeah, treat the underlying problem. Treat the underlying problem, and a lot of other things will start getting better on their own.
In psychotherapy, we have a term, it's called adjustment reaction with mixed emotional features, 309.28. And that's for somebody that's got a situation going on, so they've got some symptoms of depression, like you said, but they're not having a chemical depression. So situations, and especially if you've got a chronic situation of pain, it can affect you in a variety of ways, emotionally, mentally, physically, all sorts of things. So
yeah, oh, absolutely. So yeah, we touched on obviously what it can do inside your own world of your brain, right? How you perceive the world and what it can do. But there's that other huge component, which a lot of times goes ignored, which is, well, what happens to the outside world, the stuff that's not in your own world, the outside world? How do people treat you? How do others look at you? How motivated are you? What kind of support system do you have? What kind of the family support system, the friend support system, and all that stuff. And it's amazing that how in many cases patients with chronic pain, their family members, their spouses, their friends, their coworkers, whoever, they don't understand what's going on. And the patients then don't understand why they don't understand what's going on. And there's that communication lapse, there's the resentment on both sides, and relationships fall apart. And relationships fall apart, you're going to definitely have depression, right? So now you have this medical condition that might be causing depressive symptoms, but you have this physical and social condition that's definitely causing depression and depressive symptoms. And so it could really be a sort of a slippery downward slope very quickly, and so it's very important for that that physician to recognize that and intervene any way possible, whether that's a proper referral or whether it's through proper treatment, or even sometimes it's nice just to say, hey, listen, I want your family members to come in. I want them to come in. I want them to listen to what I have to say. A lot of times practitioners are so concerned about making sure that the family members stay out of the room and they're talking to the patients directly, which I totally understand. There's a lot of privacy issues, obviously. But once you're done with talking to that patient about whatever it is that you want to talk about, ask that patient, hey, can we bring your family in? Because I really think that it would be helpful if all of you sort of were on the same team. And involving those family members on the team, I think, is very helpful.